Today we're going to go over step by step how to choose the right Medicare drug plan. But I want you to know you should watch this video all the way through because at the end, I'm going to give you a step by step process on how to check your specific medications and pharmacies with the plans in your area. But first, let's go over the three most important things to look for when you're looking at drug plans. The first thing that you want to consider is the different formularies and tiers of drugs. It's extremely important to know that every single Medicare drug plan on the market has different tier levels for their medications, and they have different formularies, which if you don't know, a formulary is essentially just a list of covered drugs that specific drug plan will cover. And tier levels are how they categorize lower priced drugs versus higher priced drugs. So typically the higher the tier level, the more expensive that medication will be for you when picking it up at the pharmacy. It's extremely important to research every single drug plan on the market to see how it'll cover your specific medications. And like I said, don't forget to watch this video all the way through because at the end I'm going to show you exactly how to do that in about 5 minutes. The second thing that you need to consider is not just the premium, but the overall cost. A lot of times when we're meeting with clients, they just want to go with the cheapest drug plan on the market that has the lowest premium. But I would highly advise to not just base your decision off of how much the premium is, because a lot of times the cheaper plans, you may have to pay even more when you go to the pharmacy and pick up your medications, and it'll actually be more expensive in the long run. You also want to check things like deductibles as well, because some plans might have no deductible versus some plans might have a $700 yearly deductible that you have to meet. There are definitely more things to consider than just how much the monthly premium is. And the third thing that you want to consider is the pharmacy network and preferred pricing. Most people don't even talk about this when it comes to Medicare drug coverage, but where you pick up your medications, what pharmacy, actually matters a lot. Each drug plan has different levels to their pharmacy. They will either be preferred in-network, standard in-network, or out-of-network. And to put it in perspective, this is one of our clients' drug lists. They pick up these 4 medications on the left, and this is how much they pay based on what type of pharmacy it is. So this first one here is them going to a preferred in-network pharmacy, picking up these 4 medications. You can see after the deductible, they pay $7.10 a month for all 4 of these medications combined. Well, now let's say that they go to a standard in-network pharmacy, same 4 medications, but now they're paying $28.60 per month for the same 4 medications because it's an in-network standard pharmacy. And now take a look at this. These same 4 medications, but they went to an out-of-network pharmacy, are $233 a month for the same ones that should cost them $7 a month. This is why it is so crucial to do your research on your pharmacy as well and make sure you're going to a preferred in-network pharmacy to save the most amount of money. Okay, so I promised at the beginning of this video that at the end we would go over a step-by-step guide on how to get on the right drug plan with your specific medications, pharmacies, and everything like that. So let's go right now and do that. Okay, so first what you're gonna wanna do is you're gonna wanna go to this site. It's called Medicare.gov. It's the official website of the United States government. And so what you're gonna do here is this is a great asset, not only when you're turning 65, but you can actually use this to store your medications throughout the year. And then every single year when all these plans change, you can come back and see all the new changes and how your drugs are gonna be covered for the following year. But since most of you guys are not gonna be on Medicare yet, we're gonna scroll down here and we're gonna continue as a guest. So we're gonna go and click under Find Health and Drug Plans. We're gonna click Find Plans Now. And then it's gonna take us to this page here. Like I said, if you have a Medicare number already, you can create yourself an account. But what we're gonna do is we're gonna go in as a guest. So what you're gonna do is type in your zip code, click Continue, and then it's gonna ask you, do you wanna look at Medicare Advantage plans? Do you wanna look at Medicare drug plans or Medigap plans or Medicare Supplement? For this example, we're gonna click on Medicare drug plans, Find Plans Now, and then it's gonna ask you, do you receive any extra help with your health or drug costs? If you're not sure, just put no. But if you do have one of these like Medicaid or you get extra help with your drugs, go ahead and click that and then click Continue. And then it's going to ask, do you want to see your drug costs when you compare plans? Click yes, next, and then this is where you're going to be able to type in all your medications, and it's going to show you exactly how each drug plan in your area is going to cover them. So give me just a second, I'm going to plug in some medications here. Okay, so I just put all 4 of these medications in here, and just to show you how to do it real quick, all you do is click add drug, and then you type in your specific medication you're wanting to add. Say it's metformin hydrochloride. We're just going to click that, click add drug, and then you can choose whatever dosage it is that you take, plus how many you get per month, or if you get it in a 90-day supply, you can change all of that, but then you just click add to my drug list, and it'll show up right here. So now that we've got these 5 in, let's click done adding drugs. Then we're going to scroll down and we're going to click a few different pharmacies just to see what's the best price for these medications. So what I'm going to do is I'm going to click mail order, CVS, we can do Walmart. I try to stick to the bigger name ones because you're going to save the most amount of money typically. So that's 4 of them. We'll be good there. And then just go down and click done after you've done that. And then it's going to show you all of the 14 drug plans in your area. So where we're at here in Springfield, Missouri, there is 14 in our county. So it's going to show all 14 there. If we scroll down here, you can see that the cheapest, first of all, I want to say it's super important to not only focus on the monthly premium that shows up here, because just because it's lower doesn't mean that it's going to be the cheapest overall when picking up your medications. So what number I always like to look at is this number right here. Total drug cost and premium cost. So this is adding this $20.70 per month plus picking up the medications for the remainder of the year. So this number here is way more important because if we scroll down here, let's see if we can find a cheaper premium. Okay, all of these are, here we go. Here's one. So this one has a monthly premium of $0 a month, but when you pick up your medications, they're almost $2,000 a year to get your medications at the pharmacy. If we scroll back up here, this one, yeah, it's almost $21 a month, but you're saving almost over $1,400 a year on this plan that has a premium. So that's what we always suggest, is to go with this number here, not the monthly premium. And I did want to show you one other thing real quick. If you click plan details, it's going to go down to, click on drug coverage. It's going to take you down to all your medications that you put in and exactly how they're covered. So if we scroll down a little bit further here, we're going to see all 5 medications on the left here and exactly how much it costs when picking them up at certain pharmacies. So this is a great example. At Walmart, all of them for the whole year are going to be $350. Same with Walgreens. But then we look at CVS. Well, CVS is almost double. It's $630 for the same 4 medications because it's an in-network pharmacy instead of a preferred pharmacy. And then mail order, it's still preferred, but for some reason it's just a little bit more expensive. But that's them actually mailing it to your door, so you don't have to go to a specific pharmacy. But that right there, guys, is a step-by-step guide where you can see how your medications are going to be covered specifically with the plans in your area. And then last thing, you can see your monthly breakdown and how much it's going to cost. Now, I know we went over a lot of information in this video, but I want to let you know I left 2 links down below in the comment section of this video. The first one is where you can get our free 2025 Medicare planning guide at no cost whatsoever. So definitely go check out that link. It's going to help you along the way throughout the whole Medicare enrollment process. And the second link is where if you're still confused about Medicare and you need some one-on-one help, you can book a free call with me and I will go over all the different plans in your area and how they'll cover your doctors, your pharmacies, and your medications. And we can even help you enroll. All of our services are 100% free of charge, so go and make sure and utilize those links down below. Also, leave a comment down below. What's a topic that you want to hear next? And don't forget to like, comment, and subscribe, and go check out this video right here talking about how new retirees need to avoid these mistakes in 2025. I'll see you over there.